And selection, again, depends on the capacity that you have and just the sheer space that you might have. And at the Rescue and Recovery Center, we can handle anywhere from 75 to 120 animals comfortably. Foster, 135. It's not uncommon for us to have 150 animals out in foster. And especially if we're having an adoption event, adopt-a-thon that we have maybe throughout the year, sometimes that number would be much larger. At the adoption center, anywhere from 110 to 145 animals. Space utilization, and this is looking at more of this rescue and recovery center. This is kind of a simplified layout of our second floor, the rescue and recovery. And you can see these are all the different rooms that we have. And it might be like the ACC room where we have cats, ISO hall, which would have multiple rooms where we would have cats and sometimes dogs also. Excuse me. ISO kitchen, just because it's off the kitchen. Exam room, this luxurious big room is about the size of a closet. And that's where we do the exams. Excuse me. Abbott, this is a large area where we house the dogs. And you can see some of our staff here too, like animal care manager. This is Heather, who's going to oversee all the animal caregivers, the ones that clean and feed. Population manager, this is Kristen, who sees what we have at the adoption center, sees what we have in the facility, what do we need. And the shelter medicine assistant, this is after I do all the records, she'll input all that information into the computer as far as what's been done, what needs to be done, surgery papers, things like that. So just different areas here. And this is meet your match room, a little play room where the animals can kind of run around if they're indoors. And then just different storage and such. Selection, we look at it as two ways. We have a fast track and a slow track. We do best when we have 65% fast track and 35% slow track. Fast track, I should have practiced though. Fast track, we're looking at, we pull from ACC and also owner relinquishment. So ACC, it might be an adult animal that it's the time that it takes from going from ACC through our facility to the adoption center. And sometimes it can be within 24 to 48 hours. So if we're pulling an animal, beagle, that is 3 years old, already spayed, needs no dental work or mass removals and looks healthy, then it would go right up to the adoption center after it has our medical protocol done. So again, dogs over 7 months of age, dogs and cats over 7 months of age, and again, we pull from the ACC, from the city facility, and also owners that relinquish their pets to us. If they're all ready to go, we vaccinate them. And if puppies and kittens, on Saturdays we have what's called owner relinquishment, where where maybe we'll just do their first set of shots. We know that we'll be getting the kittens in another 2 weeks. But what we'll do is do the first set of vaccinations, and maybe they have a little bit of upper respiratory or something like that. We'll even give them medicines, and they go home. In 2 weeks, they come back, hopefully healthy, second set of shots, and that can be fast-tracked. So then potentially we can get a 10-week-old kitten, not in our facility, not catching diseases, etc., and right up to the adoption center. If an animal is sick, like I said, we'll provide medicine. So that's fast track. As far as slow track, we consider adult animals that maybe need some other care. Maybe they have respiratory or GI problems, and or they have a mass that needs to be removed or poor dental condition. So, and again, we pull from ACC, owner relinquishment, and these are the ones that are going to be staying with us greater than 3 days. So sometimes it might be 10 days, or it might be longer, depending on if they might be diabetic. We might want them in foster to get them regulated, things like that. So, and slow track, we have the adults that are older that need medical care or surgical care, and anything up and above our regular medical protocol initially done. Slow track, we have the kittens and puppies, and we don't like to push those through. Kittens are probably our highest risk group. We like them to have a couple set of vaccinations, and we do it. We start as early as 4 weeks of age. We vaccinate them every 2 weeks. And after that second set of shot, then they're usually cleared for surgery. And once they're cleared for surgery, then they can go up to the adoption center if they're healthy. And again, it's the fosters that we rely upon for the kittens and the puppies, especially. We try to, we joke about 3 paws down and they're out. We don't even want them staying long enough to get comfortable to put the 4th paw down. We want them out of the facility. And for as much as I think Paws is a great facility, it's not the best place. It's the best place is in a home where they can stay healthy and they can be observed and again, owner relinquishment. So as far as selection, the animals that we pull, especially from ACC, you're going to see, this is somewhat of a busy slide, but you've got like the cats, like half of the cats are going to need additional care as far as medicine or a procedure done. Dogs, probably about 30%. So on average, 38% of our new intake require medical treatment or even surgical treatment beyond the standard protocols. And I'll show you our protocol in a little bit. And again, like I said, the population target, we try to have 65% fast track, 35% slow track. Our intake from animal care and control, this is going to summary that 20% of our cats, about 20% of our dogs are going to, so about a fifth, going to require additional medical care, surgical care, and also 75% of our kittens and 60% of our puppies require additional medical care beyond our initial protocol. And 75% is a fairly high percent, but I think that just goes to show how aggressive we are as treating kittens. They might have like a little serous drainage, and if that's the case, I'm putting them on Doxy. I don't wait for it to become nasty and whatever. And most of the things that we're going to see are viral anyway, but we don't wait for them. We know that if one's sick in the litter, as far as respiratory, that most likely the other 4 are also going to get signs. So again, I think we're pretty proactive as far as using Doxy for respiratory, or maybe we have a kitten that's loose stool or something like that. And as long as it's parvo negative, it's not uncommon for us also to give Marquis or to treat coccidia or do a fecal or whatever else. This slide is, again, busy, but let me try to break it down a little bit. This is by year. So here's 2006, 7, 8, 9. It just goes to show you as far as, and this is our intake history as far as dogs and cats. And it shows you as far as maybe here we pulled almost 1,000 in 06, maybe 1,700 in 07. You get to a certain point where this is where a lot of our organization changed in regards to our staff. So maybe we just had surgical vet here, and then maybe that surgical vet even did some oversight with the medical problems that might be present. But then right around here is where we went to a full-time veterinarian, that's myself, and then we also work with Purdue with the help of Maddie's fund. Purdue is establishing a shelter medicine program, so we have a fellowship. So we're currently on our 2nd fellow, and also we have a doctor that works the weekends as far as, and actually what's so nice is that it's our 1st fellow that finished. She works the weekends, so we have really nice continuity. And also with the CVTs and the doctors, a lot of times there's one person overlap, so we kind of have that continuation of care. So I might work Monday to Friday, and then the one tech works Friday to Saturday, and the other tech works Sunday to Monday. So it's kind of a passing of a baton a little bit. So nobody walks into rescue and recovery and doesn't know what's going on as far as ones that we're worried about. So it's really, really nice that way. And then also our additional staff you see here, we just had maybe like an animal care manager, things like that. But again, here we're a little bit more ramped up as far as we've got the animal care manager who oversees all the animal caregivers, and then also the population manager. So we pull what we need, and we keep pulling aggressively. And